Assalamu alaikum warahmatullahi wabarakatuh. Hello, Joanna Club listeners. Today we have a randomized clinical trial by a Brazilian group which assessed the impact of conservative versus conventional instrumentation with different three rotary systems on the release of inflammatory mediators and the postoperative pain, specifically in mandibular molars with asymptomatic reversible pulpitis. So, the mechanical instrumentation step in endodontic treatment thought to contribute to postoperative pain due to the possible extrusion of the debris, irrigation solutions, and microorganisms into the periradicular tissues, depending on the technique or the instrument used. Another possible explanation for the postoperative pain related to the mechanical instrumentation is the incomplete debridement, which can leave infected tissue and bacteria within the root canal. And as a result, the root canal instrumentation may trigger the release of the inflammatory mediators in the periapical area. And the influx of these mediators can lead to fluid accumulation, edema of the tissues, and this compression can activate pain signals, contributing to the pain and discomfort experienced by the patient postoperatively. So the connection between the mechanical instrumentation and the release of the inflammatory mediators potentially would improve the postoperative treatment outcomes. And as the new conservative night eye systems with reduced tapers and apical sizes have recently gained attention for their ability to optimize the mechanical debridement while preserving the tooth integrity, questions remains about whether these systems can achieve thorough cleaning. So this study aimed to compare the inflammatory mediators release and the postoperative pain after conservative and conventional root canal preparations of the mandibular molars with asymptomatic reversible pulpitis. It's a single-blind, three-armed, randomized clinical study which included 45 patients diagnosed with asymptomatic reversible pulpitis. They were randomly assigned into three groups based on the system used to either ProTaper Gold, where they prepared the mesial canals using size F2, 25 apical size and 0.08 taperness, while the distal canals were prepared to F3, size 30, 0.09 taper. The other group was one-shape rotary system with apical sizes of 25 and 30, 0.06 taper. And the last group, which is the conservative group, they used the tronotomy rotary system, where they prepared the mesial canals to size 26 with taperness of 0.04, while the distal canals were prepared to 30 with 0.03 taperness. And then they collected the gingival cervical fluid at the baseline measurements and at the 24 and 72 hours after the preparation. And the inflammatory mediators, namely substance P, interleukin 6 and interleukin 10, and the prostaglandin, were quantified using the enzyme-linked immunoassays, and the postoperative pain was assessed using the visual analog scale and compared among the groups using linear regression analysis. The patients were recalled on the first and the third days post-treatment. They had no dropouts and 100% recall rate. For the results, all mediators exhibited an increase at the 24 hours initially and decrease at the 72 hours, and the release of the substance P in the one-shape group was significantly higher than the other groups, the tronotomy and the ProTaper Gold. For the interleukin 6 and interleukin 10, they were found to be significantly higher in the one-shape and ProTaper Gold groups compared to the tronotomy at the 24 hours. For the prostaglandin levels, they were not affected by the type of the instrument. For the visual analog VAS pain scores, they were significantly higher at the 24 hours compared to the baseline. When they used the one shape, they had significant association with higher postoperative pain than with the ProTaper Gold. The analgesic intake was not related to the instrumentation group or with any other patient or tooth-related factors. Based on the findings of the study, the mean percentage changes of interleukin 6 and interleukin 10 levels were significantly upregulated in the ProTaper Gold group compared to the other groups. And this might be explained due to its progressive taper design and the greater cutting efficiency, which can trigger the inflammatory responses by introducing debris and necrotic tissues. And it was shown that the sternotomy file system extruded significantly less debris compared to the portable gold. This study finding supports that the conservative root canal preparation, specifically talking using the sternotomy file system in the preparation of mandibular molars with asymptomatic irreversible pulpitis, have decreased the release of the inflammatory mediators but did not influence the postoperative pain. There are some limitations of the study, lack of the long-term follow-up, and that there might be other potential confounding factors such as the patient anxiety levels that may have influenced the pain perception and the inflammatory responses, and these factors could introduce variability that complicate the interpretation of the results. On the other hand, I must highlight that this is a randomized clinical trial design where they had proper randomization and standardization protocols for the patient selection and the treatment administration, which contributes to the study robustness. And they focused on the release of the inflammatory mediators alongside the postoperative pain assessment that could really help us to understand the biological responses to endodontic treatments, aiming at improving the patient's outcome. Thank you so much for listening. Hope you have a nice day. Bye.